Welcome to the Armed Forces Chamber podcast. I'm your host, Andre Haynes. Today we have a very special guest with us. Why don't you tell us your name and who you are?
I am Dr. Erika Smith. I'm so glad to be here, Andre.
Thank you so much for being a guest today. Let's jump right into the questions. Did you serve in the military? And if so, tell us about your service.
You know, I did not serve in the military, but I have a ton of cousins that have served. We're talking about Marines, we're talking about Army, we're talking about my grandfather was in the Navy. So I respect what they do for us, for our country, and I thank them for their service.
Wonderful. Why did you join the Armed Forces Chamber?
Why not join? I mean, it's a great organization. It's the first of its kind. So I think that it's an honor to be a part of it. The resources that we get, the benefits that we get as being a member, and being able to support the mission of the armed forces and honor those that have served and that are still serving.
Wonderful. What is the name of your business and what products or services do you offer?
Well, my business is D2D Health Management. And so what we do is consulting and management. That's kind of like our star of the show. But we do other things, licensing, credentialing. I'm also doing billing and EMR support, as well as able to offer lab services. If they want those services to be either they want their own lab in-house, or they want to be able to send out to a reliable lab that they can trust for those services. Also able to offer pharmacy services where they can have an in-house pharmacy, as well as alternative modalities, whether they're looking at adding a Botox. So I actually help medical providers. And so anything from MD, DO, DMD, DDS, RN, MP, even medical spas, if they're large, small, it doesn't matter if they're startup or an established practice, it doesn't matter. We're able to help them in that way.
Thank you. Who influences or inspires your business?
Well, I don't think anyone particular inspired it. I believe because I am a healthcare provider myself, and I don't just walk the walk, but I talk the talk. And so it's one of those things where a lot of times what happens with our medical providers, unfortunately, is they have someone helping them or claiming to be able to help them that has not been in the medical field. They're a non-medical person. And I think that is very important. And it's a unique opportunity to really be able to have someone that has walked in those same shoes that you're walking in and understands the lingo, understands the struggles of what it is to have a practice. And I think that that's the unique advantage of D2D is that you have me. And so I've owned 3 practices. And so I'm able to be able to really say, wow, I know what your struggle is. I know how to help you through these things. I know how to help you go to the next level if that's what we're doing, or, whatever that we need to do. I think that by having me, they're getting a very unique opportunity that normally they don't get, and they're not going to get taken advantage of. I think that's the biggest thing I see my colleagues getting taken advantage of. And that's what really pressed me. And how I came up with this concept for D2D was because D2D means doctor to doctor. And so it's a very unique concept that I think will help a lot of people. And I'm hoping that they're going to reach out for my help and stop using these non-medical people to help them, because a lot of times they are getting taken advantage of and it doesn't end up well for them.
Name some notable accomplishments of your business.
Well, we're actually a brand new business, so we haven't had a lot of time to have any notable accomplishments, but I am looking forward to having some, and I know that we will, because by being on this podcast, we're actually going to get some great exposure, and I think people are going to reach out now that they know that I'm here, and I think that that's the biggest thing.
When should a business or individual contact you for your services?
When?
When is the best time for them to call you?
You know what? We have a website. They can contact really, once they go on that website, we actually have a contact us page. And what they're going to do when they get to that page, they're able to fill in their information. They're able to tell us kind of what their needs are. And then at that point, I can get back to them and schedule a mini consultation, a full consultation, but all of that can be done online as well. So that they can contact anytime through via the website.
Okay. I want to expand a little bit more on that last question. If a business is brand new, or if a physician just received their licenses, or if a business has been in existence for a while, but they're looking to expand to get more patients or maybe accept more insurances, is there a better time for a business to contact you when it's in any of those stages?
Well, if it's a startup business, definitely they need, once they have their license or if they need help getting, and once they have a license, maybe they're looking to go into a different state, we can get them credentialed. I have a third party that actually helps, does the credentialing and licensing once they have their first initial license. But if they're just starting up and like they're new, right out of school, definitely I'm about that hand holding experience, because I was that person at one point where got a new license. Okay, what do I do? Do I go work for someone, or do I jump into owning my own practice? And so since I've been there, done that, I think that they need to contact me as soon as possible in that process if they're just getting started. Now, if they're an established practice, that means they're already kind of done this. Maybe they're looking to add some services, but they don't know how to add those services. Then definitely, as soon as they think that they want to maybe go in a different direction to add services, they need to contact me for sure.
Thank you. Share some advice with viewers who are physicians or managers or owners of practices.
Can you say the question again, please?
Share some advice with the viewers who are physicians or who also own or manage a practice.
Well, my biggest advice would be really to, like, I'll go back to having people come into your practice and say that they can do consulting or management and they're non-medical. They're just looking to make a quick buck. They don't care about your license, because that's very important. The license is everything. And so what happens is they'll do things that are just not compliant and can get that doctor or that licensed provider in trouble. And we don't want that. I know how important that is. But if you're not, never had to get a professional license on that level, you don't understand the importance of how important it is for that doctor to be on, for everything to be on the up and up so that they can maintain that license. Very important.
Okay. Would you like to share any last remarks?
You know, we are in such a different time right now. And I know people like, well, maybe I shouldn't start a new business. But this is the right time for you actually to start up a new business. It's the right time for you to add services to your business. And one of the services that is not on the website that can be provided is a post-COVID-19 prep. That means if you haven't quite opened up yet and you're not sure how to go about prepping your practice for your patients to feel comfortable, then definitely they need to be calling me so we can have a sit down or talk via Zoom, conference call. All of those things are available so that we can get a game plan together for your practice and how we get those patients comfortable to coming back and actually visiting the practice, and how we can build the practice based on you doing things that maybe other providers are not doing.
Where is your business located?
I am at 7473 West Lake Mead Boulevard, Suite 108. And that is our physical address, but of course we're available to be, talk to people via the website, all of that. That's why we have a great contact us page so that they can contact us there as well if they're not in Las Vegas.
Okay. And how can viewers reach your contact page or website? Where can they go?
They can go to D healthmanagement.com. So D2Dhealthmanagement.com.
Wonderful. Well, Dr. Erika, thank you so much for your time, for being a special guest on the Armed Forces Chamber podcast, and also a proud member of the Armed Forces Chamber. We appreciate your service to those who serve and also to the organization.
Well, I appreciate and I'm very honored that you asked me to be your special guest today. That's pretty awesome.
Yeah, well, thank you very much, and look forward to talking to you off air.
Absolutely. I look forward to it.
Have a great day.
You too. Bye-bye.
Bye-bye.